Hi, I'm Cheryll Moore. I'm a medical care administrator with the Erie County Department of Health. In my day-to-day operations, I'm the director of the Erie County Opiate Epidemic Task Force. We're here today to talk about a really important issue, and that's how to save a life. Anyone can learn how to save a life using the tool called Naloxone. Naloxone is a generic name for the drug. Narcan is the brand name for the drug. Currently today we're going to talk about the 4 options that are out available over the counter at a drugstore without a prescription. We've brought all 4 options as you can see here. There's a nasal format, a 4 milligram nasal format. There's a 2 milligram nasal format. There is an injectable which is very similar to an EpiPen. It talks people through an overdose. And there's also the old school intramuscular injectable format. So the products that we have here today, we have the 2 milligram nasal format, which looks like this. We have the 4 milligram nasal format, which comes in a 1-piece unit. We have the 2 milligram injectable for an intramuscular, large needle, small vial of medication. We also have the intramuscular design that is very much self-monitoring. It talks you through. It's made for people with vision issues. It's made for people that may have some manual dexterity issues. These are available over the counter without a prescription today. So an example there of how we worked. We also have a product in the community. We have Narcan boxes. You will see boxes like these that look like AEDs in the community. This medication is out there available for you to use at any point for free to save a life. So how do you save a life? What are you looking for? This is what we're going to talk about today. In this epidemic, and it is an epidemic, people are dying because they stop breathing. They've taken too many opioids of some type. It could be a prescription opioid. It could be something like a drug on the street. And understanding that drugs on the street today are not what we think they are. There's many pills out there that are counterfeit, different medications than what people think they are. This particular reversal medication works on all of them, whether it is a prescription medication or a street drug, including heroin, fentanyl, OxyContin, oxycodone, Lortab, you name an opioid, it works. Now, how do I know that someone is overdosed? Well, I happened to walk up into a store and I saw someone sitting there and they were going like this. Didn't really know why. That's called the nod. They're non-responsive when you talk to them. You ask them, hey, are you okay? They may bobble around a little bit. They may respond to you and say, yeah, I'm fine. That's a state of intoxication. Someone should not be responding like that. In a case like that, please do not walk away from the individual. If you have the ability, stay there with them, monitor with them, and see if they resolve that situation or if they completely stop breathing. If you are unable to stay with them, please call 911 and use these words. I think I see an overdose. I need a car with Narcan. Let them know where you are, where that individual is, and they will send someone by to make an assessment. Now, if that person in front of you goes down, you're talking to them, they're doing that nod thing, and they just slither right to the ground. What are you going to do next? Well, the next thing I'm going to do is give them a little shake. See if somebody's responding with a little shake. If nothing happens, the next thing you're going to do, it's called a test of consciousness. You're going to take your knuckles and make a fist just in this format, and right here on your sternum bone, you're going to rub back and forth hard. You're looking for a deep pain reflex here. If someone is overdosed, they're not going to respond. If they're in any state of consciousness, they will respond, and that's a good thing. At that point there, if someone responds, please stay with them, don't leave them. Get EMS behind you because you don't know what they've taken, so please continue to call 911 and ask for help. Now the second scenario, that person was there, they started to turn blue-gray looking, they're non-responsive when you did that sternal rub. You have approximately 4 minutes without oxygen in the human brain till the brain cells die off. That being said, you have to act right away. What are you going to do? Give the person a shake. I have no response. I'm calling 911. I think I see an overdose. I need a car with Narcan. I'm going to give them some Narcan right now. This is what I'm going to say on the phone. At the same time, I'm going to get that person flat on their back. Getting them flat on their back allows me to extend their neck and get a nice long neck and get an airway because I really want to get some oxygen into them. If I have a mask, this is a rescue breathing mask, I'm going to give them 2 breaths. If I do not have a mask, I am not going to do unprotected rescue breathing. 2 scenarios here. Get a mask. Masks are reasonable. They're cheap. You can call us at the county. We will get you a mask, so you have a mask. 2 breaths. Next thing I'm going to do, I'm going to give them some Narcan. They're laying on their back, so I've opened up my Narcan package. I put it in their nostril, and I push the button. That's it. That's it. Now I have to wait 2 minutes for this medication to absorb. This is a very long 2 minutes. If you have someone that is around you that can do the timing for you, that's really, really helpful. If you are alone, really try to get to that 2-minute time frame. It's going to feel like a half an hour. Someone is not breathing, they're non-responsive, but you have to give the medicine some time to work. If you are rescue breathing, if you have the tools to protect yourself, the mask, in that 2-minute time frame, continue rescue breathing. At the end of 2 minutes, if nothing has happened, we're going to open up another package of Narcan. We're going to open up another dose. We're going to open up the package. This time, though, we're going to pick the other nostril. And we're going to squeeze it like we did the first one. Gone. It's in the person's nostril, in their sinus cavity. The routine starts again. Rescue breathing up to 2 minutes. If nothing occurs in 2 minutes and you have more Narcan, you can always give someone another dose. At this point now, in most cases, EMS has arrived and they can take over. Our role here is to start the process, to give that person a chance, to give them a chance to breathe and to get the treatment that they need. Treatment is available in Erie County. You can access treatment 24 hours a day, 7 days a week through any emergency department, through our addiction hotline at 716-831-7007. Now that person that we gave all the Narcan to, they're on their back. They start coughing a little bit. First thing we're going to do is roll them over on their side. It's called the rescue position. We want them on their left side. We want their head up, and we're going to let them be propped up there. They're probably not going to feel real good. They may vomit. We don't want them to aspirate what they vomit. You did all this hard work to help them breathe. Don't let all your work go down the drain here. Get them breathing. Get them in a proper position. They're not going to feel good. They're going to be embarrassed. They're going to be ashamed. They don't feel good. They hurt. Be supportive. Try to be empathetic. Don't yell at the person if possible. You may learn new words from them. Just get a thick skin. It's okay. They don't feel good. I'll reiterate that again. The next day, have a conversation with your friend or your loved one. The time of the overdose really isn't the time. Once again, you can ask for help 24 hours a day, 7 days a week. Don't hesitate.